day and welcome to the Learn With Me series. I am Nurse Patience Ibaso Achiche, and the Learn With Me series is brought to you by the Set 18 Oncology Nurses in Training. Today with me in the hub is a very wonderful nurse that is always willing to share information. No other person but Nurse Kamaluddin. Nurse Kamal, you're very much welcome to the hub.
Thank you for having me.
Thank you so much for accepting to come share information to the people of the public. I would like us to meet you. Can we meet you, please?
My name is Nurse Kamaluddin.
Okay.
Student of Post-Basic Oncology Nursing, National Hospital, Abuja.
Okay. So Nurse Kamal is a very outstanding nurse. He has been practicing for over 6 years in the nursing profession. He is here to give us an introduction to what oncology is, as well as what cancer is about. Nurse Kamal, severally, I walk around the hospital and people ask me, what's this chest? What is it about? And I'm tired of explaining. So I want us to take it viral. What is this on your uniform?
Okay, this logo in our uniform is a crab, and it's a description given by Hippocrates. During his observation of cancer cells, he realized that cancer is a crab-like structure, where it has a central body and the tumor extension also looks like the leg of a crab.
Okay.
That's why he described it. And it gives it the name Tachinoma, which means crab in a Greek word.
Okay. So what is oncology?
Well, oncology is a field of medicine,
okay,
that deals with the study, diagnosis, treatment, and prevention of cancer.
A field of study that deals with the diagnosis, prevention, and treatment of cancer. If that is oncology, then who is an oncologist?
An oncologist is a medical professional that specializes in management of people diagnosed with cancer.
So why is oncology an important field in the healthcare?
Okay. Currently, cancer is one of the most leading cause of illness and death globally.
Wow.
So this field is very crucial in the sense that it doesn't only focus on treatment, rather it includes early detection, prevention, and improving the quality of life of people living with cancer.
Okay, so what is cancer?
Cancer is a large group of disease that can start in almost any body organ or tissue in the body. When abnormal cells grow uncontrollably, go beyond their usual boundaries to invade adjoining tissues and can spread to other parts of the body. Okay. This is the definition given by WHO, that's World Health Organization, in 2024.
Okay. I hear people say that cancer is a death sentence. Nurse Kamal, please, how will you explain to a layperson, someone who is not health inclined, what cancer is?
Wow. Cancer is a death sentence.
Why would you say that?
Really, that's what some people actually perceive.
Okay.
But it's just a misconception.
Okay.
Cancer is not a death sentence. It's a treatable disease when detected early.
Okay.
However, coming back to the question.
Yes, sir.
Cancer, in a simple term, is a disease that happens when some cells in the body grow and divide uncontrollably. That's like a weed in a farm.
Okay.
They just keep growing and separating where they are not needed. And these cells are immortal. In normal circumstances, cell responds to a regulatory mechanism that make it to grow, divide and also die when they have exceeded their time, when they are no longer needed, and they will be replaced with the new cells.
Naturally. That is the way God has made it.
Mechanism.
Okay. Has cancer always existed, or it is a new disease? Because of recent, we had a lot of people sharing, my auntie died of cancer, my uncle died of cancer, and we begin to wonder, is it a modern disease or the disease has always existed?
Cancer is not a modern disease.
Okay.
It has been in existence for 1,000 years. And evidence of cancer has been detected in the remains, in the human remains of ancient people.
Okay.
And it was also documented in early medical texts. If you look at it historically, apart from the document done by Edward Smith, Papyrus, which describe breast cancer. Hypocrite also, that is the person that named cancer after crab because it looks like a crab, like as we explained earlier.
Yes, sir.
So he described cancer, and as of then, treatment options were not available. They don't really know how to detect it. It's mostly considered as mass in the body, maybe in the breast, discharge, and other things.
Okay.
And another thing is that as of then, there's no much facilities to diagnose this cancer. That's why some people think it's a modern disease.
Okay.
But what actually happened, due to lack of equipment then, and treatment options were mostly, cancer was treated mostly by surgeries and with little of radiation. But coming down now with advanced technology, we have more sophisticated diagnostic machines that can be used to detect this cancer at its molecular and genetic level.
Wow.
More so, there is improvement in the management in ways to prevent
Cancer.
and manage cancer. If you look at the treatment, now we have chemotherapy, coupled with surgery, radiotherapy, and we also have precision medicine, which deals with immunotherapy, targeted therapy, and so on, which give us more ability to manage cancer more effectively.
Wow. So you are saying that the awareness on cancer has really gone far, and the modern development on the treatment and management of cancer has really gone far. That is why people know about cancer now, right?
Yes.
Okay.
As what we are doing now.
Okay.
People are actually becoming more aware
Yes.
of cancer, how to prevent it, how to detect it early, which is the main target for us to do public enlightenment, so that people will become more aware and conscious of their health. Early prevention saves life.
Oh, thank you. So are all cancers the same, or there is something that differentiates one cancer from the other? Because the public would like to know about that.
Actually, not all cancers are the same.
Okay.
They are of different types. We can take a category that is used to describe cancer majorly. We have two categories, which is histological type, that's based on the cells in which the cancer originates.
Okay.
Then another category is based on site or location in which the cancer is.
Okay. So how about based on histological classification? Briefly, can you tell us what it is?
Yes. Histological classification is majorly used by medical professionals.
Okay.
Because it's more precise. It gives an idea of the cells involved.
Such as?
Example include carcinoma.
Okay.
That's the first type. Carcinoma is a type of cancer that originates from epithelial lining or epithelial cells. Example, these epithelial cells are found in so many places in the body, such as the skin.
Okay.
We can have example like squamous cell
carcinoma.
It's also found in glands, linings of the gastrointestinal tract. The linings inside the glands also. Epithelial cells are there, and this type of cancer particularly account for almost 80 to 90% of cancer cases.
Wow, that's a lot.
Then moving forward, we have sarcomas. Sarcomas is a type of cancer that originates from supportive and connective tissues.
Okay.
Example of these connective tissues include fat, cartilage,
the muscles,
bone, muscles.
Okay.
That's where we have rhabdomyosarcoma, osteosarcoma. You had your sarcoma. It's literally telling you that.
Okay.
Yes, it's literally telling you that the cell affected or the origin of this cancer is from a connective or supportive tissue.
Okay, sir.
Moving forward, we have lymphomas. Lymphoma is a type of cancer that originates from lymphatic system. That's lymphatic. It affects lymphoid organs. It can be extranodular or nodular.
Okay.
We have leukemias. Leukemia, also known as liquid tumor. This is a type of cancer that originates from blood. That's predominantly red blood cells. That is blood cells. It affects blood cells. Then we have myeloma.
Okay.
Myeloma is a type of cancer that originates from plasma cells of bone marrow.
Okay, so that is for the histological classification.
Yes.
How about the classification based on the site or the location affected?
Well, talking about classification based on site, it's mostly going by part of the body that we know, and this is what mostly the publics are more familiar with.
Okay.
For example, if the cancer is affecting the breast, we call it breast cancer.
Okay.
When it's affecting cervix, we say cervical cancer. If it's affecting breast, prostate, we say prostate cancer, colon cancer, rectal cancer, anal cancer, lung cancer, liver
colorectal cancer,
and the likes.
Okay.
So it's mainly attached named after the organ in which it is located.
So you mentioned something about tumors, and some people begin to confuse tumors as cancers. So please, can you throw more light on that?
Tumor actually literally mean abnormal growth.
Okay, sir.
But tumors are divided
into
two major classifications, which are benign and malignant.
Okay.
So when we are talking benign tumors, these are tumors that are confined. They don't really grow beyond their surrounding. They don't go to other parts of the body. They don't do what we call metastasis.
Okay.
They don't metastasize.
Okay.
Mostly they keep going in one place. And these types of tumors, when one undergoes surgery, they are removed. He is free. Because this type of tumors are not cancerous.
And then what about the malignant cancers?
The malignant ones are the ones that are cancerous.
Okay.
Because they are the stubborn ones.
Okay.
They are the ones that infiltrate surrounding tissues.
Okay, sir.
They are the ones that travel from one place to another. They separate to parts of the body.
Okay. So
that's real cancer.
Okay. So how about the prevalence of cancer globally and locally in Nigeria? What do we say about the prevalence?
When we talk about prevalence of cancer, globally, the predominant cancers that we have at the forefront are breast cancer.
Okay.
We have breast cancer, we have lung cancer, stomach cancer,
okay,
liver cancer, and the likes.
That's for globally.
That's globally.
Then in Nigeria, what is the most predominant cancer?
Coming down to Nigeria, still we have breast
cancer.
Then we have cervical,
okay,
prostate,
okay,
colorectal,
okay,
and non-Hodgkin lymphoma. These are the 5 most predominant cancers in Nigeria.
Thank you so much, Nurse Kamaluddin, for making up time to come give us this information. Like I said earlier, Nurse Kamal has been in active service as a nurse for 6 years now, and he is always willing to give out information to whoever is ready to learn. As we come to the end of today's program about the introduction to oncology and cancer, I would like you to know that one thing is sure: cancer is not a death sentence. Cancer can be treated. Nurse Kamal, you didn't make mention of the cause of cancer. What would be the cause of cancer?
Actually, currently, there is no specific cause that we can say that causes cancer. There's no exact cause of cancer. So it's idiopathic.
So you are saying that medically cancer cause is idiopathic. Okay.
But we have predisposing factors. Okay. That's factors that contribute to the development of cancer.
Okay. I think some other time we will be taking the causes, the specific causes or the predisposing factors that will lead to the cause of cancer. If you want to join the bandwagon to create awareness on cancer and oncology, do well to like and share this video. And if you have any questions you want us to attend to, kindly drop them on the comment section and we will attend to them one after the other. Thank you for joining us today. Remember to join us every Monday and Thursday for something new in the oncology space or about cancer. Have a nice time.